Yeah, actually, the skin problem, the sagging
Yes, yes,
problem
yes,
started when
yes.
I was 19 or 20, you can say.
Okay.
The first thing that
I
started
saw that.
drawing was this
And you had a surgery and that's...
surgery. Yes, it was very thin, like generally you have flesh in that, right? It
Exactly.
started drawing down. Then we started worrying, like what exactly was happening. Then we went to this local cosmetologist or dermatologist. Then they were like surprised because they said it's a very rare case at that age. Then some of the doctors like Sanjeev or Anupankar from they suggested us to go to this what do we call it? Mohan Thomas, the plastic surgeon.
Okay.
Yeah, we went there and he has done a biopsy. Wherein in that he said it's cutis laxa, which is like premature aging or something. Generally, it happens above 75. This kind of thing. So it happened to you in a very early stage, that he said. And he said facelift is the option and temporary fillers and Botox is the option. Then he said some amount which was very expensive for us at that time. Then he referred some other doctors, Malvika Kohli and all. We went to them. They asked us to go to other doctors in Hyderabad. Then I got my first blepharoplasty and this facelift done in Hyderabad in 2008
Okay.
before marriage.
Sure.
Yeah, so this was the thing. They were done everything.
And currently, what are your concerns?
This chin part,
Okay.
this saggy part, it's been ages that I saw my jawline.
Okay.
And what they suggested me is losing excess of weight will, may even look worse.
Sure.
I shed, almost till I went till 79 in between, like 2 years back, you can say. Wherein it was like falling this much down. All these things, even worse it was looking.
Okay.
So I just want this one to be normal.
As
The
much as
skin,
possible.
if you can just see.
Yeah, I'll quickly see.
The main concern is this one, the blepharoplasty. Already it has been done. And this up and down, you can just see the brow.
Okay, well. So, yeah, we'll have to do multiple procedures to correct all of these things that you're having on the face. Okay, we can improve significantly, like a lot. But before that, are you on any medications that you take every day?
Not every day. Like it's been a week that I started medication for my back pain. It's
Okay.
homeopathy. We can stop that. That
Okay,
shouldn't be a
stop that.
problem.
Okay.
Other than that, no serious medication.
Sure. Now, so the main issues is the fact that the skin elasticity is gone for you. Okay,
Yeah.
that's a crux of the issue here. So what we have to do is to give some elasticity back by tightening. So each areas we'll have to do separate procedures. So for example, the main thing has to be a facelift on the side again, and neck lift with some procedure on the chin maybe. Because if I don't combine a hard tissue procedure and a soft tissue, you may not get like wow results. You'll get good results. Because the skin laxity is several centimeters. Now, you see what happens is, now everything we have a limitation. If it's like 2 centimeters loose there, 2 centimeters loose here, 4 centimeters loose here, so we have to add adjunct procedures in order to do, each procedure's limitation is there. We add all of that and then get the eventual desire. So that's something. So I need you to take a scan for me because I don't need a scan for soft tissue work, but I'm trying to combine some work on the inside as well, on your chin, plus tightening the muscles from inside and pulling it all up. It has to be both.
Okay.
That's the first thing for you. That's for the lower third of the face and the neck. Now, middle third of the face, you will need two procedures.
Mhm.
A lower blepharoplasty because your fat
Yeah.
pads are there, your malar things are not prominent, very exaggerated rims.
This line, yeah.
So
Yeah.
the nasolabial. So we'll have to work from around your nose and from under the eyes
Mhm.
to improve the middle third of the face. The lateral middle third of the face, that is from the outer canthus, will also get corrected when we do the facelift, because the facelift comes like this in this way along the neck lift. So now we're talking about a bilateral facelift, neck lift, vaginoplasty, bilateral nasolabial folds with the alar-plasties and lower blepharoplasties, upper blepharoplasties. And if you want anything on the forehead, because the upper third of the face starts from here, the forehead also. So for the forehead also, we'll have to do some tightening procedures.
Will these lines disappear other than if I don't get Botox?
If you don't do, with Botox, you'll not get any improvement. Botox is for mild grooves.
exactly.
This Botox will not do anything.
Mhm.
Your grooves and the laxity is so less, surgery is the only option. If not, do nothing. It's only for aesthetic reasons that we have to do all these things. So it's not going to cause any other functional issues, but you have to get under the knife. There's no other options if you wanted to correct it. I will not recommend anything else like Botox, fillers. Nothing will work for you.
Okay.
But upper third is then you have to do something called as a tightening on the forehead. We can do that also.
Okay.
So that's the whole step of things that we will need to do. I can write it down for you.
Okay.
It might take me 7-8 hours. See, redo facelifts are a little harder than facelifts the first time. Because the planes are gone. Not because the surgeon's mistake. It's just that you do once, you go back in, that surgical plane is not as easy. Otherwise, we just go in like in the planes and just go down. So it takes a little longer. What would take 20 minutes or 30 minutes on one side to just dissect would now take another 30-40 minutes extra. So you add on to both sides another 1.5 hours more. Plus we're doing multiple things. So you're looking at, I call procedures like these face makeovers because we're going to do multiple procedures here and there. I will also recommend one more thing along with this, just because you've come for a consultation. We can also do a lobe plasty because your lobe is disproportionately larger for your ears. I mean, you can look at, so we can reduce that shape as well. That's also part of your earlier facelift where constant pressure has pulled this also down.
Okay.
So, but we'll have to do it separately.
Look awkward or
No, it look nice. Don't look awkward.
Because
it's a little awkward now.
The only worry is like, many people or the actresses, they want to do something and they end up doing something.
No.
So I'm
your case
scared.
Is different. No. Those are the other end of the spectrum. You are at this end of the spectrum.
I know.
Yeah.